Hi everyone, this is Dr. David, physical therapist with Paso Manual Physical Therapy. Do you guys ever have the experience where your pain gets worse and then it gets a little better, it goes down and then it gets worse and it gets better, especially if you work out? Have you ever had your problem flare up, like say you got back pain or shoulder pain? You go work out and it gets worse, and then you take some time off and it gets better, and you just kind of go up and down like that. Well, here's why, and here's how to get out of that problem. So imagine this graph here. I'm going to draw it for you. So down here you got time, and over here you got pain and strength. Right now you might be hurting, you might have a problem that's stopping you from doing your exercise, so we'll call that day zero or right now. Your strength might be relatively low in some muscles, and then your pain or irritation might be kind of high. As time goes on and you start doing the right things, you start fixing that muscle imbalance or correcting the situation, your strength will go up and your irritation will go down. At this point where the two lines intersect is your pain threshold. All right, so pain threshold. When your pain dips down below that threshold, you feel good, you feel better. So what tends to happen is people start tapering off the therapy exercises, the therapeutic exercises, but then this also tapers off. And then you get a little weaker, and then the pain comes back. And people live in this situation where they're up and down, and this is going up and down along with them. Now what we help get people to is to this point where their strength is way up here, because then their irritation is going to be way down here. That's where you want to live, because then if you take some time off, you miss out on some of those little accessory muscles or whatever. This might go down a little bit, but you're doing this up here, and your pain never goes near the threshold. So the time frames, though, is what people get mixed up on. To get to here for your typical tendonitis, tendinopathy, ligament irritation, joint irritation, takes about 3 to 6 months depending on your specific situation. But to get out here, you're talking 1 to 2 years. So it takes a significant amount of time, and being consistent with your exercises, whatever you've been prescribed by an expert, to correct your situation. For example, if you got a shoulder problem, we frequently fix upper traps. If you got a back problem, you might have a glute weakness or ab weakness. And you might need to train those abs, glutes, or traps for this long to get to this point right here. So guys, if you have any questions about strength training, about powerlifting, about CrossFit, even if you're a cardio athlete, like you like to do running, cycling, this applies to you as well. A lot of cyclists and runners get tendonitis issues in the knees and ankles. So I hope this helps. Keep this graph in mind. If you guys have any questions, please reach out to us. Thanks so much. Have a great day.